Oh my gosh. Wow.
You feel how that just
Wow.
decompress
It just
it?
pulled everything apart. You know?
That's
Wow.
exactly what it does.
That's what I've been looking for years. Like just somebody to take my head and just like pull it up like that. So.
Hi everybody, I'm Dr. Joseph Cipriano, and today here we have our patient. Now, I know you are a teacher, 9th and 11th grade English, okay, but what really brings you in here is because of a head-on collision that you got into, correct?
Correct.
Okay, why don't you tell everybody kind of just what happened and kind of what you're experiencing now.
Okay, so like 4 years ago, I was driving down the road and a woman hit me head on. And as I saw her coming towards me, I put all my weight onto the brake to try to prevent, you know, the momentum in the crash, right? So when I did that and she hit me, the engine of my car came in, and immediately after the initial crash happened, I looked down, and my foot, my right foot, is supposed to be in front of me, toes pointing that way, but they were pointing that way. So I had a pillon fracture and it broke both of the bones.
Yep. So I'm going to put in, she actually brought images of her ankle, and you'll see the tibia and the fibula complete, like a complete break. You'll see exactly how it was broken, and you'll even see all the metal and all the rods.
All the hardware.
Yeah, all that hardware in there now that is actually keeping it aligned. But what did happen, where you are also feeling pain, because of that front end collision and everything just coming and pressing in at her, what had happened is it also pressed in, and now you're having hip pain. So for the past 4 years, you've almost felt that your hip and that leg has been compressed. That femur is being compressed into that hip, correct?
Yeah, so it was like 6 months before I was walking again. And then as a teacher, I'm on my feet all the time. I very rarely ever sit down. And so like last year I started noticing I'm having some hip pain, and it started like I put 2 and 2 together, and I said, I wonder if this is from the wreck. And so that's where I got the idea that I bet that this is all related to that crash and pushing everything up into that pelvic area.
Correct.
So that's why I'm here.
But I'm glad she's here, and so today what we are going to be doing, we are going to be doing that full body adjustment. I know a couple of the adjustments that you've seen me perform on other patients is really some of the main ones on why you came in, which are definitely things that it already sounds like that you do need, but we'll make sure and evaluate and see and make sure that it's exactly what you need. But what I want to do, I want to start off and get a baseline, kind of see where you're at, because I know you have been also having some like neck stiffness and a little bit of pain and soreness up top. So I want to put you through some ranges of motion and orthopedic tests just to get a baseline to see where you're at.
Want me to stand up?
You can stand up.
Okay.
Alright, so first I'm just going to have you look all the way up at the ceiling. Any pain with that?
No.
And look all the way down to the floor. Any issues there?
No.
Good. If you were to bring one ear to one shoulder,
That kind of hurts.
where at? On that side?
Right back in here.
Okay. And then if you were to go to the other side.
No, I just can't go down very far there.
Okay.
Maybe it's like,
So you notice when you're laterally flexing,
Yeah.
you notice issues with that.
yeah.
Okay. When you look over either shoulder.
It hurts back in here.
Same spot?
Same spot.
Okay. And the other side?
No pain.
Okay. Now does that pain, does it stay there, or does it ever travel down into the arm? Do you ever notice it going to the shoulder, elbow, into the hand?
I don't think so.
No. Okay. Mainly right in through here, maybe following a little bit.
Right in there.
Okay. Right in there.
Yeah.
Okay. Now, what I want you to do, I want you to just bend forward at your waist. Any pain when doing that?
Mm-mm.
Okay. And if you were to come back, any pain with that?
No.
If you were to come down to the side, any issues there?
No, just being out of shape.
And the other side?
No.
Okay. And then if you were to rotate, any pain with that? No. Okay. All right. I'm gonna have you take a seat. Sit up nice and straight for me. So we're gonna do some orthopedic tests up top. I'm gonna push down on the top of your head. Okay. Any pain with that?
No.
Good. We're gonna turn your head to the side. Any pain with that?
No.
Good. And to this side.
Ow.
Okay.
That didn't feel great in that same place.
In that same spot?
Right in there.
Okay, did that pain stay here? Or did it travel into the arm?
Stayed
here.
right there.
Okay. Let me see. Any earrings on?
No, I don't wear jewelry.
Okay. So I'm going to lift your head up. Any increase in pain, decrease in pain, or no change at all?
No change.
Okay, good. All right, what I want you to do, I want you to lay on your back for me.
On my back.
Yes, please. Alrighty, so I want to raise this leg up. Any pain with doing that?
Just tight muscles.
Okay. And then if I bend this foot, just tight hamstring. Okay.
Yeah.
Okay. We're gonna bend the knee, cross over. I'm gonna push down here. Any pain in the hips,
That
in the low
hurts.
back?
That hurts in the hip area.
That hurts in the hip. Okay.
Yeah.
So now this is obviously the right leg, and that's the hip that you've been having issues with. Okay. So now I want to do the same thing on the left side. We're gonna raise that leg up. Any pain in the hips or low back? Any pain with that?
No.
Okay. Same thing again. We're gonna bend that knee, come across. Any pain in the hips or the low back? So not like that right side.
No.
Okay. I want you to flip over onto your stomach for me. I'm going to bend this leg. Any pain in the hips or the low back?
No.
Good. Any pain when I bring your foot in?
No.
Or when I bring it out?
No.
Okay, good. And now we're going to do the right leg here. So we're going to bend this knee. Good. Any pain with that?
It doesn't feel great, but it's not hurting.
Okay. So a little bit. Now where did you notice that? Was it like a pulling in the front? Or was it back here that you're feeling any issues?
I think it was back here.
Back there? Okay. Now if I bring your foot in like that, any pain?
No.
Good. Or out like this, any pain?
I wouldn't say pain, but I feel it. Like,
Okay, you feel, okay.
Yeah.
But it's only on the right side, you didn't notice
yeah,
it on the left?
No.
Okay. Alrighty. So now that I already have you laying face down,
Okay.
what I'm going to do, I'm going to scan the entire body.
Okay.
When I do this, I'm going to be looking for the symmetry. Yep, perfect, hands right there. So I'm looking for the symmetry. I look at that shoulder height. I try to compare everything from the right side to the left side. So I'm going to be palpating, so I'll be feeling in on the spine. Let me know if anything is tender to the touch, okay?
Okay.
Okay, so I like to start in that cervical spine, and I'm just gently pushing in, feeling the backs of the vertebra, and feeling all the surrounding muscles. Okay. And then just let me know if anything is painful, okay?
Okay.
So we're going through that thoracic spine now. Okay. From the thoracic spine, now we're getting into the lumbar spine. Good. Okay, now we're getting to the SI joints. So if I push in right here, any pain over that right SI joint?
No.
Okay. Directly over the sacrum. Any pain with that?
No.
Or the left side? Any
No.
pain with that? Nope. Good. So we are going to come down here and want to check the leg length. So when we push in, as you guys can tell, right side is pulling short. There we go. So this is going to be one thing we're looking at. Now when I scan up the body, there's two things that I'm noticing. The left hip right here is raised up, and also on the right side, right through here, is also raised up. So these are going to be two areas that I want to focus on when doing the adjustments to help balance everything out. But what I'm noticing when I was palpating down the spine, definitely noticing some tight muscles all throughout. So what I'm going to start off with first, we're going to do the portable massage device, or actually this one isn't portable, it's corded massage device, just to relax the muscles before the adjustment, okay?
Okay.
and start the adjustment. Now I always like to start my adjustments up top at that cervical thoracic junction here. Okay, so we're going to start with the T2 on the left. There we go. And then the T1 on the right here. Okay. I know you felt how that just takes pressure off those nerves there?
Yeah.
Yeah, that just opens everything right up for you. Okay. So we're going to drop down into the thoracic spine, that upper back area here. I'm going to have you take a deep breath in and exhale out. Good. One more time, deep breath in and exhale out. Okay, good. Alright, so now I like to come back down here, take a quick look at that leg length, see if there's been any change going on. So we're going to push in. Still, it's a little bit better, but still a little bit short on the right here. So, one thing that I want to address before we go to the sacrum, I want you to sit up on the table, and I want you to basically straddle the table, one leg on either side. Perfect. Okay, so that area when I was scanning up your back on that right side here was protruding out a little bit. So what I'm going to have you do, maybe put your hands over your shoulders like that. With your thighs, keep them to the table. And I'm going to rotate you to here. Okay, and I want you to look as far as you can over that left shoulder. Good. There we go. Perfect. All right, now I'll have you lay face down again for me. There we go. Okay, so now we're going to go ahead and we're going to check the sacrum out. So I'm going to stabilize right here, and I want you to raise this right leg up as high as you can for me. Any pain, tenderness, tightness with that?
No.
Okay, good. Relax. Now I'm going to have you raise the left side for me. Any pain, tenderness, tightness with that?
No.
Okay, good. Both went up, as you guys could tell, pretty equally with that, which is a good thing. We're going to come back down here. Let's check that leg length out again. Okay, so still right short. So what that's telling me is more of a lumbar issue. So what I'm going to have you do, I'm going to have you lay on your side and face me. I'm going to have you bend that top knee. Yep. There we go. Good, good, good. All right, flip to the other side for me. Okay, so we're going to bend that top leg. Good. Good. There it was. Lay flat on your back for me. Okay. So now the next one, what we are going to do is we're going to do that leg pull. So at the leg pull, you may feel that release in the ankle, in the knee, going all the way up to the hip. So we're going to start with that left leg first, because I know the right ones are more problematic. We'll start with this side, and as you can tell, just stay nice and relaxed for me. Good. You felt how that released? Mm-hmm. You felt that going up? Mm-hmm. Good. Now that right side, same thing. Relax, relax, relax. We're going to do another one, just going up higher here. So I'm going to just bring the leg out to the side. Okay. Good, just like that. So we're just going to get just a better distraction here, so I can get more directly to the hip. Good. And back. Okay. I'm going to have you come on up. Good. Alrighty. Okay. What I'm going to do next, we want to make sure and see if all the pressure is taken off the nerves in that thoracic spine. So what we're going to do, we're going to do a anterior thoracic adjustment. Have you cross your arms just like that. Good. So from here, what we're going to do, I'm going to have you take a deep breath in and breathe out. All right, we're gonna slide you down just a little bit. Perfect, right there. Okay. So now we're gonna do the Y strap adjustment. After the Y strap, I'm gonna just kind of ask you, obviously this is the first time getting this done, correct?
Mm-hmm.
Okay. So yeah, this is gonna be that manual decompression technique. You may feel that from the neck just going all the way down, okay?
Okay.
Have you lift your head. Yep, pull your hair through for me. Good, and relax. Okay.
Oh my gosh. Wow.
And relax for a minute. There we go.
Wow.
A little bit different of an adjustment?
Yeah, yeah.
You feel how that just
Wow,
decompress
it just pulled everything apart, you know?
That's
Wow.
exactly what it does.
That felt great.
I'm gonna have you come on up. Perfect. So if you were to describe that adjustment to anybody who's never had that before, what would you tell them?
The Y strap?
Correct.
I think that would be, that's what I've been looking for years. Like just somebody to take my head and just like pull it up like that. So I think it was like, you know, just, I can't imagine the pressure that it took off of everything. You know, it just felt, I felt it like going all the way down.
Good.
You know, so it just felt like such a relief, you know.
Mm-hmm.
So, and this right here is where I've had like a lot of stiffness, and it's not stiff.
So if you bring your head to the side like in the beginning, moving around, up, down, is that different than when you first came in?
Yeah, yeah.
Good.
I feel like I could go down further. Yeah, and I'm not even sitting up straight. Yeah, I could definitely tell.
Good, good.
Yeah.
That is what I like to hear. One thing that I do want to do before you go, I'm actually gonna have you take, well, you can take both your sandals off, make it easier. But I want to work on that right ankle a little bit, so I'm gonna have you lay on your back for me, please. Okay. Yeah. So for myself, when I'm feeling in, obviously I can tell where there is the hardware. You know, that I do notice. That's why when I did that leg pull that second time, I did it from higher up, just so I wasn't as...
You could actually feel the screw.
Yeah, yeah, you can actually feel it. So what I want to do, I'm going to do some leg pulls a little bit more at that joint, just so you can get a little bit more relief, because I know that you've been having issues in here, and you've been having issues in that hip.
Yeah.
So those are what I want to work on a little bit before you take off, okay?
Okay, thank you.
Okay. There.
Hot. Whoa.
There we go. That got a nice release there for you. Yeah, then I just like to do like a shearing type movement, kind of break up any scar tissues in the area.
Mhm.
Good. And we're going to do that leg pull once again. So I'll start from here. Good. Okay. Yeah, I can already tell just how this ankle moves.
Mhm.
It is definitely different than how this one moved.
Yeah,
Yeah, you can feel the restriction in here.
yeah.
But I mean, that does come with the,
Injury.
yeah, with that injury.
Wow.
Relax, relax. Good. Okay. All right. So with the hip joint, we're going to be doing a little bit of soft tissue work. We're going to come in from the lateral aspect, kind of over that IT band, and we're just going to come up right in through here, where that femur will come in. Okay. I know that one could get a little bit tender, but I wanted to help just relax some of the muscles, especially in that area. A lot of the lateral arm side of that quad there, even going to that IT band. Definitely some
I
tight.
could feel it. Yeah.
Yeah.
I could really feel it.
Yeah, so we want to just relax a little bit of that. Just because, yeah, that leg as much didn't want to release as much as the left side released a lot easier. The right side is just holding on a lot more. May have to do a couple sessions with that to get that to let go a little bit. But yeah, we were able to get at least, we want to break up some of the scar tissue in there, just so we can get that right hip moving a little bit better, how it should.
There is scar tissue in there too because they took out part of my hip to fix my ankle. Yeah.
Yeah.
I forgot about that.
Yep. So what's happening is the normal movements are being restricted because you have scar tissue that starts to build up, and what happens is where the femur is sitting in, it's not like, actually, let me show you like this, so much easier. This is why I have a model. As you can tell, the acetabulum where the femur head would sit in, it can move around freely. Now there's ligaments and muscles all on the inside here, but what happens when there is a scar tissue that builds up, it may restrict you from going into different motions. So what I'm trying to do is, like with the muscles going from the quads coming up or that IT band on the outside, we want to just help relax the areas to allow the body to kind of release with those adhesions in there. So next time when we go to do that leg pull, we can actually get a quick boom and get a quick pull out of it. But right now it's holding too much. So there's going to be, no point where I'm not going to forcefully,
That's
do
okay.
something.
I'll gladly come back.
Of course. But yeah, I just wanted to let you know what I was doing and why I was doing the things, just so you kind of get an understanding. But yeah, so that's kind of what's going on with that right hip. But, so now overall, everything spine-wise.
Yeah, it feels really good.
Feels really good.
Feels really good. Like you said, a lot of release.
Yeah.
A lot of release, even from the very beginning when you started.
Good.
Yeah.
Good, and that's the main reason why I have people come in.
Yeah.
Perfect. Well, everybody, if you guys are looking to schedule an appointment, just go right to the website, drjosephcipriano.com. From there, if you send me a message, I try to get back to you within 1 to 2 days, but I'd love to get you in. Have a good one, guys.